Meet Dave. He's about to have a brain scan. Using the latest PET imaging technology, doctors will see Dave's brain at work. It's all possible because of tiny tracers, specially designed radioactive molecules. The PET scanner tracks the position of the tracers inside Dave, revealing his brain function in 3 dimensions. The tracers don't come from a stockroom shelf. Each one has to be made fresh at a nearby laboratory. This is Dr. Miller. He's making the tracer for Dave's PET scan. First, he needs to produce the radioactivity using a device called a cyclotron. It smashes high-speed particles into ordinary atoms, transforming them into new radioactive atoms. Now the clock is ticking. The new atoms are giving off their radioactivity, becoming plain old regular atoms again. There goes one. It means Dr. Miller and his team have to work quickly to build the tracer, a biological molecule. This is what makes PET so unique. The molecule could be anything: a sugar, a protein, a hormone. Each one is tailored to a specific function in the body and will show doctors where in the body that function is happening. Dr. Miller's team runs special chemical reactions to create a tracer from a drug used in the brain. The new tracer must pass quality control. It is purified and checked that it will function properly. The tracer is ready to use. Good work, Dr. Miller. The precious custom-made molecule is rushed to the PET clinic. Just the right level of radioactivity is measured out. Then it's injected into Dave's bloodstream.
A PET scan creates 3D images of the body. It does this by using radioactive tracers, which are usually administered to a patient through intravenous injection. The tracers are made up of carrier molecules that are tightly bonded to a radioactive atom called an isotope. The carrier molecule can interact with or bind to specific proteins or sugars in the body. The carrier molecule that will be used depends on what the doctor is looking for. If she suspects cancer or is monitoring a known cancer's growth, she may use FDG, a modified form of glucose, which gets absorbed by tissues. When tissues absorb a lot of glucose, it may indicate a cancerous tumor. The radiation from the tracers poses little danger to the patient since they quickly pass out of the body. The isotope produces small particles called positrons, which interact with surrounding electrons. This interaction results in the complete annihilation of both particles, releasing 2 photons that speed off in opposite directions. The detectors in the PET scanner measure these photons and use this information to create an image of the distribution of FDG in the body.